So I don't think I really realized how sick I was until I had to start staying in the hospital.
They tried multiple different medicines, procedures over the years. Unfortunately, none of them worked, and then she ended up going into heart failure.
I was going to babysit my 3-year-old niece. I was running after her and started to feel a little bit winded. My mother knocked on the door. I went to go get up, and that's when I fell and passed out.
Montefiore Einstein has a long-standing prominence in care of the heart. One of the first open heart surgeries occurred here. The development of the pacemaker was here. Very early on, we innovated in minimally invasive therapies for the heart, the valves, the vessels. Vascular care has always been a superior and home game strength.
The Montefiore Einstein Center for Heart and Vascular Care is a distinguished team of experts dedicated to eradicating cardiovascular disease, but also who have this culture, this willingness to collaborate.
They do inspire you by their commitment, their passion, and their humanity towards what they're doing, because Montefiore is a complicated mission.
It's really a hospital that's there to help whoever needs help, and it takes a very special person to work for a hospital like that.
We have 20, 30 people sometimes involved in the care of one single patient, and they all work together seamless, like the function of a very sophisticated Swiss watch.
I don't remember much of what happened the next 12 days. Little by little, each piece from the doctors and the nurses and from my family members, they told me what happened over the last 2 weeks. Doctors diagnosed me with myocarditis. It's basically a virus that attacked my heart. They used machines were basically helping with the function of my heart and lungs.
What makes us uniquely qualified is that we understand our capabilities. And when you have a combination of individuals who work together, you aren't fearful of taking on the real challenges.
They eventually weaned me off each machine slowly and saw that my heart was regaining its strength, so I didn't need the transplant.
To come down to the hospital and to see some of the technology, some of the new techniques that were at work, and it was extraordinarily impressive.
If I or any of my loved ones had to go through a similar procedure, I'd have absolutely no concerns after seeing what I saw that day.
Then it was early Monday morning that Dr. Weinstein had come in and said she survived 3 cardiac arrests. We were lucky enough to get her back. She may not survive a 4th. And what they had recommended at the time was the mechanical heart. My sisters from different states flew in because nobody knew what the outcome was going to be. And we just waited all day, and then she came out and she was still very, very sick.
I woke up on life support, and I was obviously unconscious before that, so I didn't have a say in getting put on an artificial heart pump.
Finally stabilized her to the point that we were very fortunate that we only had to wait 10 days for a heart.
It's one thing to hear that you have something wrong with your heart, but it's a whole nother thing to hear that you need someone else's heart.
We're highly focused on innovation, and that innovation is not just scientific and technological, but it's also in how we provide the care. We're leaders in keeping people well.
People will find that part of the hospital, that part of the mission that appeals most to them. And it could be the community work that's being done. It could be, again, the clinical work. It could be the research work. But there's really something for everyone at Montefiore.
But even for somebody who wants to say, I want research in something that I am dealing with, or if there's an ailment in your family, or you're suffering through something, why not help and let somebody else benefit?
It's not just taking out a checkbook. It's thinking about what your potential impact is on life, on your community.
It can be a small amount, but small amounts add up into larger amounts, and it's all for the greater good.
Each day she got stronger, she got better. Then she had the tube out and she was home 10 days later.
The transplant, like literally, it restarted my life. Like I'm such a different person now because of it.
Starting high school was the true test of getting back into the routine of homework and tests and all that, and she excelled. And she continues to excel.
I can do anything.
When you look at our outcomes, whether it's survival after a heart attack, survival after treatment for heart failure, we have among the best outcomes in the country.
My grandfather was very ill, and he had been to all these different doctors, and nobody could help him. They basically said he had a few months to live, and that was that. And he ended up living another 4 years, a very healthy, good quality of life, and I'm very grateful to Montefiore Heart Center for that.
When I realized everything that happened, it's scary to actually know that I may not be here. I wouldn't have a chance to something simple as come to work or see my nieces. And thanks to Montefiore and all the doctors, I was given that second chance.